back. You're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. I'm Mabel Jung. Thank you so much for joining us. A very special welcome to those of you who are joining us online. And in our studio, our very last interview of the day, Jeff Myers, President and CEO of Medicaid Health Plans of America. We tried to save the best for last, Jeff.
You are too kind.
We try to do that.
To be here. Thank you.
Well, let me ask you, you just finished a panel discussing some very wide-ranging topics.
Right.
Can you give me some of the key takeaways that you would like to leave with attendees?
Well, I think the drug panel, in my view, was one of the most important for this 3 days. It really looked at not just the cost of drugs, the value of drugs, and where the future is likely to be headed. We had Express Scripts, a large PBM, Medicaid Health Plans of America. We had a pharmaceutical manufacturer on the panel, and we really talked about what that future looks like and what changes are going to need to happen to get there.
Okay, one of the issues that you talked about, I understand, was the opioid epidemic, a growing crisis in America. What is going to happen in terms of Medicaid and as it relates to opioids and payment of opioids?
Well, I'm glad you asked. The opioid crisis is obviously in the news every day. It's affecting our neighbors, our friends. It's no longer a small, out-of-the-way illness. This is a major crisis in America, and unfortunately for us, the epidemic is centered right in Medicaid.
Yes.
With the expansion population, they are the most likely to have these issues. And the plans and the states are really trying to think through what are we going to do to slow this down. It isn't just about slowing down access to opioids. It can't be about just prosecuting folks who are addicted. It really has to be about treatment and recovery. And the plans are thinking through how to build those networks, how to get those individuals in. In fact, MHPA is focused on that in June, looking at how the plans manage pregnant women who are addicted, and unfortunately those babies that are born addicted, and what kind of networks the plans need to build to really break the cycle of opioid addiction.
Yes. What are some of the strategies that are being talked about?
So 3 big ones. The first is addressing the crisis in pregnant women. In the Medicaid population, this is doubly terrible because they obviously have an addiction, and they're going to give birth to a baby that has addiction right at birth. So that creates a double whammy for health plans and the states that pay for it. So plans are really looking at how can we help treat women who are addicted before they give birth, knowing that in many cases that addiction has been going on because they were injured a year ago. And then secondly, how do they build networks that encourage those women to seek treatment and let us know how we can help them? And then the last issue is how do we control for those opioids that are already in the marketplace that either came through licit or illicit treatment areas? How can we work with the states to really get them to slow down that process? And that's what our plans are focused on.
What about payment strategies, whether maybe addressing not paying for certain circumstances and taking a real close look at individual cases and if they should be covered by Medicaid?
That's exactly right. That's what we're looking at. We're trying to slow down that cost. And there are some new products in the market that hopefully will reduce the abuse side to allow the plans to really focus on adherence where opioid use is warranted.
Right. Opioids is just part of the picture of some of the things that you're looking at. Drug prices. What is the position of your organization as it comes to deciding where drugs should be priced and where that is headed in the future?
Well, it's a great question. Look, we want a free market to work. Unfortunately for pharmaceuticals, the value of creation is now divorced from the cost of creation. And that value is absorbing a lot of taxpayer dollars unnecessarily. In our view, we believe that Medicaid now reaches 1 in 5 Americans. It directly impacts closer to probably 1 in 3 because Medicaid pays for more than half of long-term care in the United States. So the sandwich generation that has to worry about my kids in school and my older parents are really crushed, and Medicaid helps cover that long-term cost. So when we look at moving forward, one of the big drivers is drug cost. And our view is because 73% of Medicaid enrollees are in managed care, that managed care can provide an answer to slow down those drug prices and the cost of those drugs. And one of the ways we're really looking at doing it is building the cost into the plans so that the rebates are matched to the plan, and the plan looks at the total cost of care so that pharmaceutical manufacturers get the value of their creation, but the taxpayers are protected from really a pricing model that doesn't seem to make a lot of sense anymore.
Have you been in talks with pharma companies about this? And what is the reaction?
So the Medicaid drug rebate program is incredibly complex. One of the things that is obviously of interest to them is being allowed to provide services to the plans, which the plans desperately want. That's going to require some significant statutory change. And they've really helped us think through what that would need to look like. They're not supportive yet, of course, but they are helping us refine the message as we go to Congress and the administration to talk about this may be one way to address overall drug pricing and the cost of medication.
Any concerns about the impact on innovation?
Well, from our perspective, we believe that the Medicaid drug rebate program has become almost a gravitational pull and forces drug companies to price, well, not as rationally as they would otherwise. And so addressing this, I think, may help encourage that innovation much better than, say, direct government negotiation in Medicare or importation from Canada.
Okay. How closely do you have to be watching what's going on here in Washington, since it seems to be changing hour by hour? But
well, I have to laugh. My first panel at what was a tremendous summit was, where is Medicaid going to be in the next 3 to 5 years? And I jokingly said, I'm not really sure where it's going to be in the next 3 to 5 weeks.
Or hours.
Or hours, is what we're seeing from in the House with all of their priorities moving around. Ultimately, look, whether the legislation being considered today or tomorrow is going to pass, Medicaid is an incredibly important healthcare program. It is now incredibly expensive. The financing clearly is not sustainable over time. Something must be done. We believe we have a solution for policymakers, talking about how plans can take risk and drive out some of the inefficiencies in fee-for-service. We'd love to have those discussions, and I suspect we're going to have them because it seems unlikely right now, as we speak today, that the current proposal to reduce federal spend in Medicaid by 25% is probably unlikely to get through.
Okay. And my final question is, how are the conversations going here at the World Healthcare Congress?
Well, this is a fantastic Congress. I mean, it's great to get, you have payers, you have manufacturers, you have folks outside of the Medicaid space. And so it really is an opportunity, I believe, to see what else is happening outside of my little silo. And I know our team loves to be here, and so we've really enjoyed it.
Jeff Myers, thank you so much for your time.
Thank you very much.
Thank
very
you.
nice to see you.
And thank you for joining us these past 3.5 days. For all of us here at the WHCC studio team, Hugo, Rena, and also Jamie and Michael, thank you so much for joining us. We appreciate you tuning in. See you next year.